In today's STS TV Science Spotlight, a new study examines the prediction of surgical risk in a growing population of adults with congenital heart disease. Dr. Elaine Griffeth led that study, and she's here now with the results of her research. So let's start with the population at the center of this study. What were the specifics?
So we studied all adults with a congenital heart disease. So those are patients who've been born with a heart defect and they've grown up into adulthood. Most of these patients have had prior operations. In our study, we looked at specifically those who are undergoing reoperation, so at least their second, third, fourth operation. We took out those patients that only had isolated bicuspid aortic valves because that population is more consistent with an adult population of kind of senile aortic stenosis. So our population was really looking at those patients that were adults with true kind of congenital heart disease.
Why was it important to differentiate and study this group compared to a broader adult cardiac population?
So adults with congenital heart disease are quite different than the broader adult cardiac population. Overall, kind of their lesion set that they have and the hemodynamic impacts over time kind of result in a different type of physiology for those patients. Additionally, a lot of these patients are undergoing multiple time reoperations throughout their lifetime. And so compared to a traditional broader adult cardiac population, these patients are having their kind of second, third, fourth operations.
Let's talk about the results. So I want to know what the overall results of your study were, but I also want to talk about the risk of post-surgical complications for adults with CHD.
So overall, we studied in this population what the risk of, or the kind of prevalence of operative mortality was, as well as a composite morbidity mortality outcome. These patients are interested in not only the operative mortality risk, but also the impact of meaningful survival after surgery. So what are the risks of different types of complications that would be considered major? Operative mortality in this population was 6.6%, which is higher than some prior studies. You know, again, I want to emphasize that this is a reoperative population, and it is also excluding some of those lower risk patients, such as those isolated bicuspid valves.
How did you utilize AI learning or machine learning?
So we use that whenever we are kind of doing our analysis and risk model development. And so traditionally when you're developing a risk model, lots of times people would use logistic regression or potentially a penalized logistic regression model. Machine learning, and it's kind of, especially with gradient boosting technology, you use iterative tree building processes to kind of develop and learn a model and kind of help narrow down your risk prediction to be a little bit more accurate. In this group, we used that paired with traditional techniques, so that way what we ended up with was a risk model that was not only lean, but highly discriminative, as well as something that could be interpreted.
And of course, it's only as good as your data. So talk about how vital the STS database was for your research.
A lot of research in adult congenital heart disease has been performed at high volume single institutions. And so being able to take some of our prior work and expand that to the national population with the STS Adult Cardiac Surgery Database was essential. The national population is what we're really kind of trying to move the needle on, and I think we have a lot of opportunities there. And we're not able to do that type of research without an STS database.
And let's talk about the real-world impact for those patients. More people are living with congenital heart disease than ever have before. So let's talk about the results, how they're being utilized to enhance and improve patient outcomes.
Now there's more adults living with a congenital heart disease than kids. There's 1.2 million adults across the U.S. living with congenital heart disease. So this is a large population that a study like this could potentially impact and benefit. The goal for this type of study is just to continue to build the groundwork for developing a surgical risk calculator that could be used to help inform patients in preoperative discussions, help them know what their risk might be after surgery for a serious complication or potentially something like operative mortality. We know that come from kind of institutions like where I come from at the Mayo Clinic, we have built decades of adult congenital care, and we've got a strong multidisciplinary model. And I think being able to see the differences in kind of how that care model may impact outcomes and how to translate that on a national scale is going to be something that's helpful.
Well, Dr. Elaine Griffith, thank you so much for joining us and giving us a little sneak peek into your presentation here at STS. Have a great day.
Thank you.